lot of people aren't interested in older adults or helping seniors age in place if they aren't a close relative. So my problem is, how do you identify the characteristics of individuals who are interested in volunteering to help seniors in their community, if only for a few hours a week? Driving to medical and shopping, lessening their isolation, which we know studies been all over the place lately showing that isolation leads to illness and hospitalization. And how do we get them to help seniors with tasks that are simple, like climbing a ladder to change a chirping smoke detector battery or a light bulb? Guy with the falls. Prevention needs. We know we don't want seniors climbing ladders to change smoke detector batteries. So once we can identify characteristics of the right people for this volunteer corps, which I think exists out there, how do you engage them? How do you get to them?
So my name is Keith, and I run a credit union, and so I'm transitioning or looking to transition from the financial world into the healthcare world. So we've talked about people, and we've talked about the continuum of care, and one of the things that I was looking at was, how are we helping those that can't afford the care, or those that are underserved, or those that need help with car repairs or such, so they can get to the doctors or that they can get to care. And so that's where I'm looking at it from, is just the financial side of it.
Hi, my name is Thijs. I work at the Dutch consulate on healthcare. So basically what we try to, Rogier is my colleague, he's over there. What we try to do is to, so as you all know, Dutch healthcare, it works really well in most areas. So what we try to do is export Dutch healthcare and then import American innovations. So I just want to share with you an idea or a company from the Netherlands that we're working with right now to bring them to America, because I was told it would be a really interesting topic for you all. So the company is called Buurtzorg, which means neighborhood care, and its CEO is a nurse. It started 6 years ago, I think, and they now have a revenue of 800 million euros, so they're doing really well. And the CEO, Jos, he looked at the current home care system in the Netherlands, or the previous home care system in the Netherlands, and he saw it wasn't working, because for every act of care, there was a different caregiver. There was a registered nurse to do like the really medical stuff, and then there was a home care person to, I don't know, clean the house, stuff like that. And so the American approach probably is that for every caregiver, you choose the best option, the cheapest option that delivers the most quality. And then we in the Netherlands said, this isn't working. What we're going to do is we're going to get a team of 12 registered nurses, so highly educated nurses, and they're going to take care of the entire neighborhood. And they're self-managing teams. There is no management involved. They decide their own budget. They decide their education. They manage their own time. And this would sound like something that's really expensive, because the registered nurse is also doing the house cleaning. And it turns out in the end, this is cheaper, about 30% cheaper than the old system, where you have different caregivers for different acts. And also patient satisfaction and employee satisfaction is much, much higher. And it's really successful. We're exporting it to Japan and to Belgium and to Scotland now. And we're working on exporting it to America. So not my idea, but still really interesting. Yeah.
Med students. So we've been brainstorming a lot on this. And one of the pain points we're realizing is, if we're really going to try to deliver this to the end users who are at risk, who maybe already are showing dementia.
Elderly, like dementia patients that, struggle with like wearing devices and also like utilizing them.
Oh yeah, go ahead. So the end point is we do need a little bit more input. Maybe some of you guys can help us out with how could we make a wearable device affordable and also more rechargeable, because the issue is the end user still has to be cognizant enough to actually make sure that this is syncing. Yeah.
Great. So if anybody has got expertise in that, we will certainly have mentors tomorrow as well to help you with that. I know somebody in the back of the room, Frank, who has given these issues some thought.
I think it's more like it's not just like affordable and usable, but it's also like for people that have dementia and that have cognitive disabilities, like the ability to use these devices, that we're really working on trying to optimize that for them. It's yeah, it's not. I guess for me, it's not really affordable. It's more like usable, right? So someone that has like cognitive disabilities, like you really need to work with them in terms of how to make it the easiest way to use these devices.
So my colleague and I, Shireen, I would like to basically talk about how do we achieve continuity of patient care with switches in care providers, such as residents having different shifts, attending physicians, medical students, so forth. Addressing those shifting issues are really paramount, because it's really difficult to figure out when a resident will finish their shift versus another attending, and so forth and so on. The timing and all that needs to be addressed. So we like to optimize that service and make the care team, the theme of the whole event, much more efficient for those particular providers. Thank you.